Welcome everyone. My name is Dr. Alvin Berger. I am the co-founder of LifeSense products. I am pleased to share with you the exciting clinical findings with our GlucoLogic tea. I'd like to start with an abstract of the study. LifeSense is the only company in the world, to our knowledge, using patented, clinically proven ingredient Reducose in a functional black tea. This is not a pill for those of you who do not like swallowing pills. Many of us eat too much sugar and too much starch in our diet. This leads to elevated blood sugar, which is bad for our health. We need a new tool to lower our blood sugar. That tool is GlucoLogic tea containing Reducose. Reducose works by partly blocking the breakdown of food carbohydrates in the gut, decreasing the glycemic index of dietary carbs. This lowers post-meal blood glucose and insulin responses by an amazing 40%, which is great for our health. Fast carbs become slow carbs. Maintaining healthy blood sugar levels is super important for optimal health. It reduces insulin resistance, prediabetes, type 2 diabetes, weight gain and food cravings, and lowers energy swings, to name a few. For the remainder of the presentation, we will show you the blood glucose lowering benefits of GlucoLogic tea in two subjects consuming diverse carbohydrate-rich foods. By way of introduction, let's step way back from talking about elevated carbohydrates in modern societies to how we have changed as a species over time. When we were hunters and gatherers, we were very muscular. During the agricultural period of development, we were also very active and probably ate pretty well. However, during the industrial period of development, we no longer eat so well, particularly in the last maybe 50 to 70 years when we started drinking and eating lots of sugar, leading to a high incidence of obesity in our population. Now, as a continuation from that previous slide, let's look at how much sugar is actually consumed in the USA by each person each day. In 1820, 2.5 grams per day of sugar was consumed. By 1970, 153 grams per day was consumed, a huge increase. And by 2023, 190 grams per day of sugar was consumed per day, which is an enormous amount and not great for our health and our waistline. Simple sugars are molecules like glucose and fructose, which rapidly elevate blood sugar. Simple starches contain collections of these simple sugars, and they can increase blood sugar even more than simple sugars. These starches are, however, not counted as added sugars on the food label. Yet, as we've said, they are rapidly converted to sugars, increasing blood glucose, and are not good for our health when they're consumed in large amounts. Not all starches are bad. Resistant starches are beneficial. Carbs and starches are prevalent in our food supply, bad for our health in large amounts, and difficult to limit intake of. What we need are new tools to limit the impact of these starchy molecules. Welcome, GlucoLogic tea. There is a lot of important information on this slide that we could spend a lot of time discussing, so I will just introduce the basics. Hallmarks of prediabetes and diabetes are impaired fasting glucose, which is elevated blood glucose before we have eaten. Another marker is impaired glucose tolerance, which is when blood glucose is too high after consuming a meal due largely to our insulin not being able to effectively get the blood glucose into our cells. And this is referred to as insulin resistance, which is bad. The new gold standard for optimal blood glucose is referred to as time in range. The goal is to spend as much time as possible in the optimal 70 to 140 range throughout the day as possible for optimal health. And with tools like GlucoLogic T, this is more achievable than ever. Another way to think about our goal in controlling blood sugar is to get off what we call the blood sugar roller coaster ride. What we mean is when you consume processed sugars and starches in the diet, your blood sugar is going up and down all day long. And so you get feelings of energy and then low energy, high energy, low energy. And then when you overshoot the baseline value, you end up feeling really low in your energy level. To improve this situation, what we want to do is consume a diet that does not contain very high levels of these sugary foods and simple starches. So as shown in the bottom, if we consume this type of diet, the blood sugar goes up and down, but the peaks are much lower and the blood sugar goes up more gradually and comes down more gradually. This is what we're trying to accomplish, and this allows us to have more time in range in that 70 to 140 milligram per deciliter value we showed in the previous slide. Now in this slide, I'd like to summarize the materials and methods that were used in this small pilot study. The subjects were a man, 63 years old, and a woman, 58 years old, who were fasted overnight for 10 to 12 hours. Blood glucose was measured with a Dexcom G7 continuous glucose monitor that was inserted several hours or the night before testing. Blood glucose was then monitored on an Apple iPhone with the Dexcom G7 application. Dexcom G7 Clarity was then used to track start and end blood glucose and other key points. In the morning after the 10 to 12 hour fast, the subjects consumed a single food item with 46 to 85 grams net carb, with different amounts and types of simple sugars and starches. The following day, the same food item was consumed, but with one serving of GlucoLogic T, which provided 250 milligrams of Reducose, which was consumed concurrently with the food item. Between pairs of days, food items were consumed at the same time or up to 56 minutes apart. The man and woman consumed the same food items, except the man consumed a brownie in one of the tests and the woman consumed matzah in one of the tests. Rice and matzah were consumed at double the labeled portions on the package in order to emulate what might be consumed by the general public. The results are shown graphically in the slides to follow. Each pair of days are shown stacked, aligned by start time, with the data shown for 6 a.m. to 3 p.m., with the time of consumption to 4 hours post-consumption highlighted in a gray zone. On this slide, we show the details of the GlucoLogic T packaging. Shown on the left panel is the front of the package, and on the right side is the rear of the package. I won't go into detail here because you can study this on the website, or perhaps you're an existing customer and you already know all these details. Slide 11 shows us the schedule for the various food items that were consumed. On the left side is the schedule of items consumed by the man, and on the right is the schedule of food items consumed by the woman. Slides 12 through 17 show the detailed composition of all the food items that were consumed. In the red box will be the total carbs, the fiber, and the net carbs is total carb minus fiber, and also the sugars in the food item and the added sugars. And then the composition of the ingredients is also shown, and bolded are the ingredients that I consider most important with respect to effects on blood sugar. The results are shown on slides 19 to 28. I will review the next slide, slide 19, the bagel challenge for man, in detail, and then allow you to review the other result slides on your own. The results are then summarized on slide 29 in tabular form and in text on slide 30. Results are finally discussed and concluded on slides 31 to 32 with scientific references for the study provided on slide 33. As noted, I will discuss the bagel challenge for the man in detail to explain the format of this and other graphical result slides to follow. In the graph itself, the black text shows the bagel alone. The blue text shows the bagel plus GlucoLogic tea added. The grayed in area shows 4 hours post-consumption. Start times for the bagel and the bagel plus tea are aligned to facilitate comparisons for the 2 days. Starting and ending blood glucose values are shown at the intersection of the reddish horizontal line and the blue vertical lines. Blood glucose values in milligram per deciliter and times for key points such as peaks and return to starting values are indicated. Results are described in the bullet points below the graph, with black text referring to the bagel and blue text referring to the bagel plus tea. The yellow highlighted area shows the rise in blood glucose to reach peak blood glucose value after the bagel. The blue highlighted area shows the rise in blood glucose to reach peak blood glucose after the bagel plus tea challenge. Points refer to the units of blood glucose change in milligram per deciliter. As for the results themselves, we see that with the bagel alone, blood glucose increased by 32 points in 60 minutes and stayed above starting blood glucose values for 4 hours. With the bagel plus tea, blood glucose surprisingly increased more by 59 points in 54 minutes, returning to starting blood glucose in 84 minutes. Conclusion: the tea did not lessen the spike in blood glucose for unclear reasons, but the tea dropped blood glucose more rapidly. We're not sure why this happened, but we hypothesized that perhaps the starches that were present in the bagel were somehow pre-processed to make them more resistant or fiber-like, so that the tea could not exert its normal effect of lowering peak blood glucose. The starches in the bagel were tapioca starch, potato starch, and corn starch, which are known to be sensitive to processing conditions during the manufacture of the bagel. So overall, for reasons that are unclear, we can say that the tea did not have an advantage for this particular food type, meaning the gluten-free bagel. So to summarize all the results for the two subjects, with Cheerios, we found that there was a 16 to 24% decrease in peak blood glucose with the tea, which is highly beneficial. We also found that there were slower declines from the peak blood glucose values with the tea, which is also beneficial. Decreases in postprandial blood glucose peaks, slower declines from peak blood glucose benefit the time in range. That's that 70 to 140 milligram per deciliter value that we spoke about, and would also potentially lower hemoglobin A1C, which is a longer-term marker of controlled blood glucose. In terms of the rice, we similarly found a very impressive 26 to 46% decrease in peak blood glucose, and this is also beneficial. With fries, there was a 28% decrease in peak blood glucose, but for unclear reasons, this was only seen with demand. There was a decrease in secondary peaks and slower declines from peak blood glucose, and this is also beneficial. With the matzah, there was a 39% decrease in peak blood glucose, also beneficial. There was no change with the bagel, which we speculate could be due to some pre-processing of the starches, which makes it so that the active ingredient in the tea, Reducose, could not exert its normal competitive absorption advantage in decreasing blood glucose. With the brownie, there was no change in blood glucose, and we think this could be due to the fact that the brownie contains mostly simple sugars rather than starches. So overall, there was a 16 to 39% decrease in peak blood glucose values with the tea, which is highly beneficial. There were slower declines from the peak blood glucose in some cases, which is also beneficial. These decreases in peak blood glucose, slower declines in blood glucose, have benefits for blood sugar management and weight management, and would also benefit sustained energy. Similar results have been observed in quite a few clinical trials that were performed with the active ingredient Reducose in separate clinical trials. So this shows that the Reducose in the tea is also highly efficacious in reducing blood glucose. To conclude, in a 63-year-old man with impaired fasting glucose, which is a pre-diabetes marker, and a 58-year-old woman with no impairments in blood glucose regulation, Reducose-containing tea, known as GlucoLogic tea, beneficially reduced postprandial, primary and secondary blood glucose peaks, and likely slowed starch digestion when starchy-rich foods were provided at the same time. This highly beneficial result is consistent with results observed in numerous clinical trials performed previously with Reducose as an active ingredient present in pill form or in other food forms, some of which are shown in the references at the end of this slide deck. The tea was effective against many of the starchy foods that were evaluated. However, it was not effective against the starch-rich gluten-free bagel that was provided, and we speculate that this could be due to the food processing that made the starches resistant, retrograded, or fiber-like, or because the bagel was also rich in fiber. The tea was not effective against the brownie, a gluten-free brownie actually, that was provided to the man, likely because it provided simple sugars, monosaccharide sugars, and Reducose works mainly to slow reduced digestion of starches and complex sugars. Overall, results show that GlucoLogic tea provided with starch-rich and complex sugar-rich foods can beneficially reduce blood glucose peaks and beneficially decrease the sharpness of blood glucose peaks, meaning slower rises and slower declines in blood glucose. GlucoLogic tea could help people maintain more time in that 70 to 140 milligram per deciliter optimal range known as time in range or TIR, and potentially reduce hemoglobin A1C, which is a longer-term marker of optimal blood glucose. There are many benefits to being in this optimal blood glucose range, including improved weight management, improved cardiovascular health, improved gut health, and much more. Please see the next slide to view this graphically.